You don't always need to know what's wrong before you know you need someone to talk to. Maybe you've been feeling overwhelmed for weeks. Maybe you're having trouble sleeping, concentrating, or managing stress. Maybe your relationship has become difficult, you're dealing with a major life change, or you're carrying something that you simply haven't been able to work through on your own. And then comes another question. What kind of therapist should I actually see? Finding psychotherapy isn't just about finding a clinic with good reviews. You also want to think about the type of support you need, the therapist's areas of experience, the approach they use, and whether you feel comfortable working with that person. Welcome to Review Remedy by ScoreDoc, where we turn healthcare research into practical information you can actually use. Today, we're looking at 3 best psychotherapy clinics in Vancouver, Washington in 2026. We'll introduce the 3 practices featured on ScoreDoc's list, and then walk through what you should consider when choosing a therapist, preparing for your first appointment, and deciding whether a particular type of therapy may be appropriate for your situation.
And there's an important distinction to make right away. Psychotherapy isn't one single type of treatment. Different therapists may work with different concerns and use different therapeutic approaches. You may hear terms such as cognitive behavioral therapy, or CBT, dialectical behavior therapy, or DBT, trauma-focused therapy, couples counseling, family therapy, or other approaches. The important thing isn't necessarily knowing which acronym you need before your first appointment. It's understanding what you're hoping to address and finding a qualified professional whose experience and approach are appropriate for those concerns.
Our first featured practice is integrity counseling. Integrity counseling serves individuals as well as couples, children, teens, and families, with counseling services covering concerns such as anxiety, depression, trauma, grief, relationship issues, parenting, stress, and other life challenges. The practice also offers different therapeutic approaches, including services such as EMDR and couples-focused approaches. That brings us to an important question to ask when you're researching a psychotherapy clinic. Does this provider regularly work with the issue I'm seeking help for? That's particularly important because a therapist's overall credentials don't necessarily tell you everything about their experience with your specific concern. If you're looking for help with trauma, for example, you may want to ask about the therapist's trauma-focused training and experience. If you're looking for couples counseling, ask how much of the provider's practice involves relationship work. And if you're looking for therapy for a child or teenager, ask about the therapist's experience working with that age group. You don't have to arrive at your first appointment with the perfect diagnosis, but having a general idea of what you're struggling with can make it easier to find a provider who is a good match.
And there's another factor people sometimes overlook: therapeutic fit. 2 qualified therapists can use completely different communication styles. One may be very structured and goal-oriented. Another may use a more exploratory approach. Some patients may prefer a therapist who gives them practical exercises between sessions. Others may prefer spending more time exploring thoughts, emotions, relationships, or past experiences. There isn't necessarily one style that's best for everyone. The question is whether the approach works for you.
The second provider on today's list is LifeStance Therapists and Psychiatrists, Vancouver. LifeStance provides a broader range of behavioral health services with therapists, psychologists, psychiatrists, and other mental health professionals within its network. That can be useful for people who may need more than one type of mental health service. For example, someone may initially be looking for psychotherapy, but later need a psychiatric evaluation or medication management consultation. LifeStance also offers different forms of therapy and treatment approaches, along with in-person and telehealth options depending on the provider. So here's another question worth asking. Do I need a therapist, or might I benefit from a broader mental health evaluation? That's not something you necessarily need to answer by yourself. A qualified mental health professional can help determine whether your concerns are appropriate for psychotherapy alone, or whether another type of assessment or treatment may be useful. And if medication is part of the conversation, psychotherapy and medication don't have to be viewed as competing choices. Depending on the person's circumstances, they may be used separately or together under appropriate professional care.
There's also a practical advantage to having different types of providers within a larger behavioral health network. Your needs can change. You might begin therapy because you're dealing with anxiety or stress and later realize there are other concerns you'd like to address. Having access to different types of mental health professionals can make it easier to discuss those changing needs. But regardless of the size of the organization, the individual provider still matters. Before scheduling, look at the specific therapist's credentials, specialties, treatment approach, availability, and whether they're accepting new patients.
Our third featured practice is Mindful Therapy Group Vancouver. A group practice like this can be useful for another reason. You may have more than one potential therapist to consider. Different providers within the same organization can have different specialties, experience, treatment approaches, and schedules. And that's important because finding a therapist isn't necessarily about finding the highest-rated clinic. It's about finding the right provider within the clinic. For example, imagine you're looking for therapy for anxiety. You may find several therapists who treat anxiety, but one might primarily work with adults, another may specialize in adolescents, and another may have additional experience with trauma or relationship concerns. Those differences can matter. So when comparing therapists, don't stop at the clinic name. Look at the individual provider. The therapy selection checklist.
Let's turn that into a simple checklist. Number 1. What are you hoping to address? You don't need a formal diagnosis. Think about the problem that brought you to therapy. Is it anxiety, depression, stress, grief, trauma, relationship difficulties, family conflict, a major life transition, or simply feeling like you're having difficulty coping? Having a starting point can help you identify relevant specialties. Number 2, does the therapist have experience with that concern? Look beyond the clinic's overall list of services and check the individual provider. Number 3, what therapeutic approach do they use? Ask the therapist to explain how that approach works and what therapy might look like in practice. Number 4, do practical details work for you? Check availability, appointment times, location, telehealth options, insurance, and out-of-pocket costs. And number 5, do you feel comfortable communicating with a therapist? This one can take time to determine. You don't have to decide after reading a profile online whether someone is definitely the right therapist. The first appointment can also help you determine whether the working relationship feels appropriate.
And there's something else you can do before your first therapy appointment. Write down what you've been experiencing. You don't need to create a perfect explanation. Just make a few notes. When did you first notice the problem? How often does it happen? What seems to make it better or worse? Is it affecting your sleep, work, school, relationships, or daily activities? Have you tried anything already? And what would you ideally like to be different after getting help? Those details can give your therapist a much clearer starting point. Also, bring any information the provider has requested, including relevant medical or treatment history. And don't worry if you become emotional or aren't sure how to explain everything. You don't have to walk into therapy with the answers. That's part of what the process is for.
There's also an important safety point. Psychotherapy can be an important part of mental health care, but it isn't the right response to every situation by itself. If someone is experiencing an immediate mental health crisis, thoughts of suicide or self-harm, severe confusion, or another urgent safety concern, they should seek immediate professional or emergency assistance rather than waiting for a routine therapy appointment. For less urgent concerns, starting a conversation with a qualified mental health professional can be a useful first step.
And remember, therapy isn't a test you can fail. Sometimes the first therapist you meet won't be the right fit. That doesn't necessarily mean therapy isn't working. It may simply mean that you need a different communication style, specialty, treatment approach, or provider. It's reasonable to ask questions. It's reasonable to discuss concerns about your treatment. And it's reasonable to look for another qualified provider if the therapeutic relationship isn't working for you. The goal is to find care that you can actually engage with consistently.
So if you're researching psychotherapy in Vancouver, Washington, ScoreDoc's 2026 list gives you 3 practices to start with: Integrity Counseling, LifeStance Therapists and Psychiatrists, Vancouver, and Mindful Therapy Group, Vancouver. But don't treat the list as the final decision. Use it as a starting point for your own research. Compare the individual providers, their specialties, therapeutic approaches, availability, costs, and the type of care you're looking for.
We've included the complete ScoreDoc guide in today's show notes so you can explore all 3 featured practices and continue your research. Because finding a therapist isn't really about finding someone who can simply tell you what's wrong. It's about finding a qualified professional who can work with you to understand what's happening, develop appropriate goals, and help you move forward. And sometimes, the hardest part of therapy is simply making the first appointment. You don't have to have everything figured out before you make that call. Thanks for joining us for another episode of Review Remedy by ScoreDoc. Until next time. If something has been affecting the way you think, feel, work, or connect with others, don't dismiss it just because you can't explain it perfectly. Asking for help can be a very practical first step.